Nobody had my introduction. I told you that if you're not ready, please tell me that. I'll put you minimal grade, depends on your MISA test, and that's all. Finally, the half of group wasn't fine ready, and we waste a lot of time. Okay. Next topic and after next topic, just briefly because of previous issue. Mesencephalon, aqueduct, and diencephalon, third ventricle. Actually, you have a biggest problem with the object recognition. That's why let's try to find the object from this topic. And about cerebellum, one more. I want to emphasize because it's important for you as for future doctors. It's easy to remember. We have to simplify the structure, the connections, and the function. We have to remember number of 3. We have 3 functional parts of cerebellum. We have 3 peduncular cerebelli, and with 3 main functions of cerebellum. We have first, its body balance, vestibular system, vestibular-floccular, not responsible for that. And mostly the connection we have, with some exception, minor exception, we have via the inferior cerebellar peduncles. The second one, it's the postural muscle tone for body position. For that, mostly responsible anterior cerebellum or spinocerebellum, and the connection realized via the superior cerebellar peduncles. And number 3, it's precise, voluntary, fine movement, the professional ability, writing, carving, fishing, whatever. For this responsible posterior lobe, the biggest lobe, because most complex movement regulation, and the connection via the middle cerebellar peduncles, via the pons and to the cortex, because it's the highest function of cerebellum. Why it's important to remember 3 parts, 3 functions, and 3 connections? Because as a future clinician, you have to understand to examine the cerebellum of patient, the cerebellar function of patient, you have to do 3 kind of test, 3 type of test: for vestibular system, for postural function, and for fine movement. That's why the simplest test, as example, again, usually how actually does this look like? You asking the patient to just to stay and to straighten the hand. Can it keep the muscle tone and to keep the postural muscle? Okay. The next, you asking the patient to close the eyes. What does it mean? If the patient can't keep the body balanced with closed eyes, it's problem with this first function, the body balance. And the second, third step, you ask the patient to reach the tip of nose, to touch the tip of nose by the fingers. It's a precise, fine movement. That's how it works. The straight position, muscle tone, to close the eyes, the body balance, and to touch the tip of nose. It's a fine, precise movement. It's primitive, simple test, but again, 3 step, because we remember 3 function of cerebellum. That's how it works. You study anatomy not for your journal grade, but to be a doctor. That's why I try to understand how you can use it in the future. Okay, midbrain, the next step in our way to the highest center. And let's start from, again, from the sagittal section. I'm sure you remember brainstem. In brainstem, we have medulla, we have pons, and the next step is midbrain. I was confused because the half of group can't recognize that passage, cerebral aqueduct, the tube between the 4th and 3rd ventricle. Just brief tube, Sylvian aqueduct or cerebral aqueduct, whatever. The midbrain, we can distinguish 3 parts. We have pedunculi, cerebri, or crus cerebri, not cerebelli. Again, cerebelli, it was the previous topic. We have pedunculi cerebri now. Next, we have tegmentum, And next we have tectum. That's why your first task, you have to be able, absolutely clear, to differentiate, to see three main parts. What is the border between the pedunculi and tegmentum? It's substantia nigra, the black substance here. That's why in front of black substance, it's pedunculi cerebri, behind it's tegmentum. What is the border between the tegmentum and tectum? It's cerebral aqueduct, actually, which you can't recognize today. Again, pedunculi cerebri in front of substantia nigra. Next, we have tegmentum, all these biggest area. And next, we have tectum. I'm showing you only the object you have to recognize. For level of 4, it's enough. Next, what you have to be able to recognize, again, aqueduct, cerebral aqueduct. That's why if next time you will tell me or Miss Julia that you can't, you don't know what is that, excuse me, come on. Substantia nigra, I already mentioned. I don't want to explain what is that and to cite the book. I just want to show you the practical skills, the object you have to be able to recognize. Because all theory you can find in the book. Your biggest problem is ability to find the object on images. Next, you can see here red nuclei. This is exactly the nuclei, which is the beginning of rubrospinal tract and the final destination for dentorubral fiber from today's topic, from cerebellum. If you remember actually exactly the fibers of superior cerebellar peduncles, you can find that one of the tracts here, it's dentorubral tract, or cerebellar rubral, whatever you could call it. Those, and it looks like Mickey Mouse. Yeah, you can see with eyes, nose. Yeah. There's this again, substantia nigra and red nuclei on the middle, and this cerebral aqueduct tube. From internal structure, you don't have to recognize anything more. All another just theory. Theory, yeah, you have to be able to recognize again and to introduce what exactly. Let's try to complete. Cerebral peduncle, peduncle cerebri. You have to know that this is only the bundles of only descending tract, only descending, only efferent. No sensory path in peduncle cerebri. That's why the damage of here, the tumor, for example, of hypophysis here, the tumor which affect the pedunculi, manifested as the problem if they're actually descending tract only. Done. And the list of tract, which particular here again, please find in the book. I don't want to cite it. What we can find there? There, you have to divide on gray matter and white matter. And gray matter, first question, again, come on, boys and girls. The first question in any part of brainstem, you have to be able to answer the cranial nerve nuclei, which you can find there. In midbrain, we have oculomotor nerve nuclei, 2 nuclei we have trochlear nerve nuclei, and we have mesencephalic nuclei of trigeminal. That's why if you're still not familiar with the cranial nerve nuclei position, please back to the book and find the cranial nerve nuclei position for midbrain, for the pons, and for the medulla, respectively. This is the very powerful, very efficient way for neuro pathologic specialists, for neurosurgeon specialists to recognize the location, to differentiate the small problem with brainstem using only symptoms. If you see the problem only with oculomotor and trochlear, no doubt you have to check midbrain, because you remember this is only one common place for these two objects. That's how it works. Again, first question, cranial nerve nuclei. Second, again, gray matter, red nuclei, already mentioned today. Theory, back to the book. Next, specific nuclei of the brainstem and midbrain. We can find here also neuron of reticular formation. We can find also here so-called substantia grisea around the cerebral aqueduct. You don't have to recognize that on any images, just the theory. But you have to remember that it exists inside the midbrain. And of course, the favorite object and the favorite nuclei of all the students, it's corpora quadrigemina with two colliculi. And the nuclei inside. Colliculi, excuse me, let's change the color. Red one, it will be colliculi superior. Blue one, colliculi inferior. What is that? The superior colliculi, and everybody cite me. The superior colliculi subcortical center of vision. The inferior colliculi subcortical center of sound system. Excellent. Explain me, what does it mean? They're responsible for vision and inferior responsible for acoustic system. What is that? What does it mean? Nobody can tell me. Let me clarify. Because again, for what you need these knowledges? To understand the symptom of damage in the future. Not to cite the book, but to be a doctor. The superior colliculi is subcortical center, which is responsible for involuntary reaction on sudden visual objects, sudden light, for example. What does mean involuntary reaction? You see some kind of object or light, your first reaction, involuntary, to move your eyes, the head and neck inside of object. Or for example, if it's light, if it's strong light, you close in your eyes and you move on opposite side. You don't care to think about that in that moment. Next second, you think, what is that? That's mean this symptom. That's mean this function. The second, the green one, inferior colliculi, same but for acoustic. You hear the sudden sound. What are you doing first moment, first second? Involuntary, you rotate your eyes, your head, and your neck in the side of this sound, direction of this sound. That's how it works. That's why please stop to claim that in the case of damage of this, we have problem with visual and problem with the hearing. No problem with vision, no problem with hearing. But know this involuntary reflex. What's happened in a case if the patient get problem with the superior colliculi? No involuntary reaction, but voluntary. After he think that, okay, I see some object, he can rotate his eyes and his head into direction of, but it will be voluntary with some delay. And that's why the patient claim, oh, I'm become so slowly. I see something and I slowly rotate it to the side. Something happens with my reaction. No reaction because no reflex. What's happened with damage of this? No problem to hear something. But patient can rotate the head after the voluntary cortical order. After they think, I need to rotate my head, excuse me, in the direction of the sound. That's why the reaction is slowly on such an irritation. That's why it's not so easy to recognize the local damage of these centers. Even if we are talking about elder people, who care about the time of response to elder people or sudden sound and sudden light? Nobody. That's why it's very difficult in the beginning of development of tumor of that site to understand using only such a symptom. But again, we don't care about clinician aspect. You have to understand clearly the function. This is again superior colliculi, subcortical center of vision, which is responsible for involuntary, emphasize it twice, involuntary reaction on sudden visual object, sudden light, for example. Inferior colliculi, involuntary reaction subcortical reaction on sudden sound. That's how it works. And the last I want to introduce you on midbrain, actually, it's how you have to recognize the position. Because looks like it's a kind of challenge for you on wet organs, on MRI, whatever. On MRI, again, sagittal section, for example, or wet organs, whatever. Let me choose the wet organs, maybe. Pictures. Oh, we have here both. Perfect. This one of the images. If it will be offline exam, you can get such an organ, for example. It's exactly our museum organ. Here we have aqueduct again. And you remember what we have behind the aqueduct? Tegmentum of midbrain. This is the tegmentum. Let me show again to compare with these images again. The blue aqueduct, and behind we have tegmentum. Sagittal section on the model. Blue behind aqueduct, we have tegmentum. Just remember the order. And that's all. Aqueduct, behind we have tegmentum. Horizontal section. Aqueduct, behind the aqueduct. Let me show you aqueduct if you don't understand what I'm talking about. This is the aqueduct, behind we have tegmentum. The model of the brain, wet organ, whatever, the order is the same. Pictures, model, wet organ. We're talking about human anatomy. Aqueduct, behind the blue, we have tegmentum. In front of aqueduct, on wet organs, we can recognize substantia nigra, and moreover, on sagittal section, we can recognize substantia nigra, but plus minus somewhere here, we have tegmentum, excuse me, tectum here behind, oh my God, tectum behind and tegmentum in front. Tegmentum here. Tectum behind. Let's find the same on that section, the green color. Yeah, there we have again in front of, between the aqueduct and substantia nigra. If you see the substantia nigra, absolutely no problem to find the range, to find the margin. Tegmentum. Here. Excuse me, green I need. Tegmentum. And the last one, deeper, because this is sagittal section on midline. We fall into the interpeduncular fossa. What color I need? Let's choose the red color. This is, you can see the inner surface of peduncle cerebri. Here the same, peduncle, red color, peduncle cerebri. And here, on that horizontal view, in front of substantia nigra, peduncle cerebri. That's why, please, not just to cite the text, but build this model in your mind. Every time I recommend for my student, whatever the atlas you have, draw your own schema. Find the set of color pens, yeah, pencils, whatever, markers, whatever, and try to draw the schema of cross-section. After that, try to find the same on the real models. Do this again, aqueduct and substantia nigra as the central object which help us to distinguish the parts of midbrain. Behind the aqueduct, tectum. In front of aqueduct, between aqueduct and substantia nigra, tegmentum. And in front of substantia nigra, peduncle cerebri. Done. Next. The space between peduncle cerebri we call interpeduncular fossa. After that, if you remember this order, if you remember the schema, let's find the same on the 3D model, and the same you're going to be do with the real wet organ. I remember this is dorsal view. What I can see on the dorsal view? On dorsal view, I can see only tectum with tectal plate. Done. Now let's try to, let's imagine we have the model of only brainstem. We need to rotate it slightly. And what I can see there, on lateral view, I can see big side of peduncle cerebri and the top of tegmentum. And here, the tectum, which we already recognized. Now I rotate in front. I remember this is the front. How I can understand this is the front? I can see big belly of the pons. If I see big belly of the pons, then I made a mistake. If I see rhomboid fossa, this is dorsal side. If I see big belly of pons, this is the ventral side. What I can see on the ventral side? I can see the perfect view of pedunculi cerebri, and between them, I can see interpeduncular fossa. That's all. Now let's try to complicate our task, because we are slowly moving to the next topic, to diencephalon. We'll be back to midbrain a little later. Let me reset it. Yeah. And let's start our diencephalon. The diencephalon, you have to remember, again, I don't want to but I have, yeah. On MISA system, you can find two beautiful guidelines. Anatomy of interbrain, third ventricle, and anatomy of midbrain. Please, I beg you, use it. Don't hesitate to follow this link. This is for you, not for me. Those. Midbrain. In diencephalon, you have actually to remember 4 divisions, 4 parts. If you're familiar with these 4 parts, no problem. These parts are hypothalamus, thalamus, metathalamus, and epithalamus. Now let's try to find them. I don't care about smaller object now. I just want to find the big areas which do belong to the particular division. This is the midbrain. Midbrain. In front, follow my mind. In front of midbrain, we have hypothalamus. I don't care about small object now. This is the next step. First, I have to recognize the position of macro area. Hypothalamus, the hypothalamic area in front of midbrain. Done. Above the midbrain, we have thalamus. Again, I don't care about nuclei on that step. Adhesio, pulvinar of thalami, don't care. Thalamus. Above. And like tail of this big fat guy, we can see which color I need to choose. Pink. Let it be pink. Epithalamus. This is the schema. Only after you understand the main position of this division, you can try to find the smaller object. Metathalamus you can't see on sagittal section. That's why I miss it. Okay. Okay. Now let's move closer. And again, the same. Now I used one color. Midbrain, thalamus, excuse me, hypothalamus in front. Thalamus and epithalamus. After that, if you know theory, let's try to find the smaller object. But the best way, I recommend you, the best way to start to recognize the smaller object, it's to use the frontal and dorsal view. I recommend you to start from this. If you're talking about if we are talking about the thalamus, the diencephalon. But for that, let me find all the parts. I confuse it why they miss that. Diencephalon, visual pathway we need for sure. Yeah, okay. Now, before we are going to the schema of to ability to recognize the hypothalamus, let me draw you the small, easy, and funny object. 1, 2, 3, 4, 5. What's that? Anatomy? Yeah, this is anatomy. Optic tract with chiasma opticus. Tuber cinereum with infundibulum in the middle. Mammillary body. Now we remember the schema. Let's try to find this. Here, I use the same color. Optic nerve, chiasma opticus, optic tract, tuber cinereum, infundibulum, mammillary body. That's all. And from the previous topic, your favorite and well-known peduncle cerebri. With interpeduncular fossa. Now we have completed the design of frontal view of the upper portion of our brainstem. That's how it works. Please draw your own schema and simplify. Don't try to immediately recognize the small object. Septum pellucidum, commissura anterior. Forget about that. Try to find the big object and try to well recognize this object from different point of view in different section. This is your task. It's impossible to be a high educated specialist in nervous system for the first year student using only few topics, few classes. This is the design of frontal view. Now we are rotating on the back. Do you remember what we have on the back? Yeah, I'm sure. Above the midbrain, we have what? Epithalamus. All this is epithalamus. And what we have here? Epiphysis, actually. Like the central object of epithalamus, penile body. Exactly above the corpora quadrigeminea. That's why if you see the corpora quadrigeminea from midbrain, if you see this, above we have only penile body, only epithalamus, epiphysis as a central part. After that, the smaller object from theory, such as habenula, habenula trigon, blah, blah, blah. But if you forgot this, it's not a big deal. But if you can recognize the main part, the center of epithalamus, of course, what we are talking about. And last, from this view, actually, I want to show you again the thalamus. because the dorsal part of thalamus we can see from the back. We can't see it from the front. From the back, yeah, we can see. That's why the final design of this area, why I can't clear this. Yeah, it looks like, again, midbrain with the corpora quadrigeminea, colliculi superior, colliculi inferior, epiphysis here, thalamus there. That's why I recommend you to draw. And even if you use the atlas, of course, it's not so good to draw actually over the atlas pictures, but you can draw it virtually for yourself to simplify the schema. The Netter atlas is quite complex for you at the beginning, but small pictures of memories may be not enough. You need the bigger object to well visualize this projection. That's how it works. And the last I want to show you, it's metathalamus, where you can find it, because everybody confused it by the metathalamic structure. Actually, the metathalamus on wet organs, you can see laterally. I show you the direction laterally from midbrain on dorsal view and little lower than the thalamus. This is exactly the metathalamus. This is exactly the metathalamus. That's why if you see the sagittal section from the midplane, you can see the metathalamus. You have to find this. You have to recognize it. That's why if you have the on exam practical skills, you have the task to find the metathalamus. You have to choose the dorsal view of the brain, the dorsal view of brainstem, and that's area. Here we have lateral geniculate body and the medial geniculate body. Lateral connected with the superior colliculi. You remember it's center of vision, and the medial connected with inferior colliculi, it's center of acoustic system. Same there. That's all about the visualization of the midbrain and the diencephalon, which you have to know, and all what you need to add for the good grade is just to add the theory. If you will be able to recognize all the object I show you, it's not a lot of, and it's not the small object. I'm giving you only the main object, the main structure. It's enough for you. For level 4 with plus, it's enough even with the mild theory. But if you'll be good in theory, no problem to hit 5 if you're able to recognize only that object. If you're able to recognize more than I'll show you, then I have showed you, okay, just plus for you. And the same, just again, just a few minutes, the same if you have like that, for example. Let's draw the same there, no problem. Cerebral aqueduct, you can see this bright spot. Now you remember what we have behind? Tegmentum, excuse me, tectum, again, my fail. Tectum. What we have in front? Tegmentum. Somewhere here we have substantia nigra. And in front of substantia nigra, we have pedunculi cerebri. And on the middle between, which color we have here? We have fossa interpeduncularis. And by the way, the perfect example. What is that? I'm a mammillary body. What is this? Tubercinereum. What is that? Infundibulum. And what is this? Chiasma opticus with tractus opticus. Absolutely same. Absolutely same, because we're still talking about human anatomy. Just remember the design, and you can recognize even on MRI. No problem. No problem. Okay. Thank you. Finally, I almost lose my voice. I think it's enough for today. Have a good evening.
Thank you, sir.
Have a good day.
Thank you, sir. You too.
Bye, 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 bye. Bye, bye.
Bye, sir.